Big Cat Rescue, Hospitalized Animal Care Class. Animals under quarantine and their enclosures. When an animal is in quarantine, it can be there for a variety of reasons, some of these being new arrival to the sanctuary, injured animal needing cage rest and/or observation, sick animal or animal that has been exposed to a contagion, animal that has had a medical procedure, animal that has special cleaning requirements. The quarantine animals may be housed in a variety of enclosures and locations. Any area posted "Quarantine Area, Authorized Personnel Only", a recovery cage inside the cat hospital, a recovery cage outside the cat hospital, permanent or temporary, rehab cages at north end of property. Some animals are kept under quarantine restriction their entire lives. The sand cats are an example of this, as were the snow leopards in the past. Their immune systems are fragile, and therefore to ensure that they are exposed to as little contaminants as possible, they are only given purified water, bleach foot baths are used when entering their enclosures, and separate cleaning tools are maintained at each of their enclosures. Other animals are kept under quarantine restrictions for a shorter amount of time, most often because they are sick, injured, or are recovering from a medical procedure. These animals are primarily housed inside the cat hospital in recovery cages or directly outside the hospital. The indoor recovery cage may be placed directly outside to provide the animal with sunlight and fresh air, or the animal may be housed in the permanent outdoor recovery cage next to the hospital. If an animal requires a long time under quarantine, but is not otherwise injured or recovering from a medical procedure, it may be housed in the rehab enclosures or in its permanent enclosure, in which case bleach foot baths would be used when entering their enclosures or barricaded section, and separate cleaning tools would be maintained at the enclosure. Standard procedures for quarantine cage cleaning. When caring for quarantine animals and cleaning quarantine cages, special measures must be taken to ensure the safety of the volunteer or staff, as well as the safety and health of the animal. New gloves must be worn when handling cleaning tools or materials from within the cage to eliminate contamination, and these gloves must be discarded before moving to another cage or task. Foot baths may be required to eliminate cross-contamination if entering or exiting the cat hospital, enclosure, or barricaded section. Foot baths are a shallow pan containing undiluted bleach. The bottom of your shoes should be thoroughly submerged in the bleach. In some instances, gowns, masks, and rubber boots may be required to enter a quarantine area. These items are usually available at the area that is under quarantine. A separate set of tools, scraper, tongs, bucket, brushes, and bags must be maintained near the quarantine area for cleaning the quarantine enclosure. In order to prevent cross-contamination, these tools must be used to clean the quarantine enclosure only, and may not be used on any other enclosure. If there are multiple animals under quarantine in a particular barricaded section, each enclosure may require a separate set of tools. Water bowls must be cleaned thoroughly. In some cases, the animal should be given purified water for drinking. Food trays must be cleaned thoroughly and all food scraps collected and discarded. All feces, enrichment, and other materials that do not belong in the enclosure must be removed daily and discarded. Large enrichment or brush that is removed from the enclosure must be discarded in the appropriate manner, and any buckets, wheelbarrows, or carts used to haul the items must be disinfected with bleach. All material leaving the quarantine area must be disinfected with bleach or sealed in plastic bags. Special considerations for indoor quarantine cage cleaning. Cages kept inside the cat hospital must be cleaned daily, sometimes several times a day. Drop cloths may be used underneath hospital cages to collect urine, vomit, or blood. These cloths should be replaced daily. The cat hospital floors must be disinfected. Good ventilation for quick drying of the hospital cage or the hospital floor should be provided, and care must be taken to ensure the animal is not subjected to harsh-smelling cleaners. The animal should be provided with a clean, dry area at all times. In some cases, bedding may require changing several times a day. Most of the hospital cages are equipped with a sliding door on one end and swinging doors on the opposite end. These cages are used in pairs with the sliding door ends facing each other. The cages are connected to one another using snaps. The cage is then covered with large sheets or blankets to provide darkness, which makes the animal feel more secure. Care should be taken to ensure the sheet goes all the way down to the ground on all sides of the cage and covers the top as well. An exception would be if the animal is being monitored via webcam, in which case a portion of the cage should remain uncovered. In order to gain access to the cage that needs cleaning, the sliding door should be lowered, locking the animal in the other cage that does not require cleaning. The empty cage can then be accessed using the swinging door on the other end of the cage. Great caution should be taken when shifting an animal between hospital cages. The animal could be very agitated due to its condition. Many times it is required to have 2 people present when caring for these animals. Bedding that is dirty should be washed next door at food prep. There is a washer and dryer located on the screened-in porch. When handling bedding, gloves should be worn and care should be taken to not touch any of the bedding to any other surface. Bedding should be only washed with other bedding from the same animal. Other items should not be washed with the bedding from a quarantined animal.